to think about happy hips for a happy pelvic floor. The hips and all the musculature of the glutes and the backside of the pelvis are deeply connected to what's happening at the pelvic floor. So in thinking about the pelvis and position, during pregnancy, we tend to take on a more externally rotated position at the pelvis. We have a lot of pressure and baby happening in the thoracic cavity that is pushing all of this pressure downwards into the pelvis. So we take on that more externally rotated position to both receive that pressure. Also, just due to postural changes, we tend to kind of go into that waddle position. And also think of this as your pelvic inlet. So baby has to pass through the pelvis to then make its descent. So it makes sense that it would take on a wider position as well. But if we think about that wider position, we can see how this impacts what's happening at the pelvic floor versus when we're in that more internally rotated position. So thinking about that hip range of motion, I can take this to kind of demonstrate what would happen with the pelvic floor muscles when the hips are shifting. So as the hips are kind of moving, let's get this guy situated. So this would be kind of more of like that neutral position. So when we aren't necessarily like in a lot of external or internal rotation, our pelvic floor is at rest. So we want to think about our pelvic floor kind of like a trampoline. So it's able to respond and to different demands in pressure, and we want our pelvic floor and our thoracic diaphragms to coordinate. So as we go into external rotation, you can see that the pelvic floor sort of descends down. And then when we come into that internal rotation, the pelvic floor ascends and becomes more taut. So you can see how the hip range of motion is going to impact what's happening at the pelvic floor. And the problem isn't external rotation or internal rotation, it's that we want to be able to access both so that our pelvic floor can be that trampoline that we want to respond to shifts in pressure and different demands of regular life. So we want to be able to find both external and internal rotation, and the problem becomes when we get stuck in one position. So I love incorporating different hip rotational movements in exercise programs to give us that and open up different movement at the hip, which is then going to have a direct impact on what the pelvic floor is able to do. I love working closed chain movements. We also have open chain. We want a little bit of both. Closed chain would be a fixed femur and the pelvis moving on a fixed femur. So you can imagine your foot staying pretty still into the ground or your knee, and you're essentially rotating over that leg or wherever that leg is. So even something simple like a bare hip shift, when you have a yoga block and you're essentially just rotating the pelvis over that fixed femur, not only is this going to lengthen the tissues on the backside of the pelvis, but we're also working on that hip shifting and finding some lengthening on the backside, which a lot of moms really need. So finding that rotation through the hips is going to allow us to have a nice, happy pelvic floor. If we think about all the muscular attachments in the pelvis, everything is so closely connected, and we want to be able to access both internal and external rotation. So as I demonstrated with the band, you can see that the pelvic floor kind of moves and responds differently based on pelvis position, and we want both of those ranges of motion so that our pelvic floor can be the trampoline we want it to and respond to shifts in pressure.